So good evening, everyone. Thank you for joining. Today I have a special guest that will be talking to us about oral hygiene, and you'll get to know more about your teeth and how to get it taken care of, how to avoid certain things because they're not good for you. They may fade your teeth. I know I'm a victim to that. I'm a coffee drinker, heavy coffee drinker. Anyway, so we will talk about that, and I hope you guys enjoy this session. So, Mr. Chris, thank
Yes,
you
yes, yes.
for joining, Dr. Chris. So you'll be telling us about what's going on. So please introduce yourself and let's go from there. Over to you, sir.
Okay. All right. Thank you so much. Can you hear me? Is it pretty clear?
Yeah.
Okay, good, good. Yeah, my name is Chris Emuedue. I'm a dentist. Been practicing for close to 20 years, both here in Dallas, New York, Illinois, and partly in Nigeria. Um, I've have three kids, and that's just pretty much who I am in a nutshell. Uh, been in Dallas since about 12, 13 years now. And, I consider myself a Texan. So that's just pretty much me in a nutshell.
Yeah. So, do you want me to give you control? Do you want to show anything, or do you want
Oh, no,
to jump into Q&A?
yeah, I'll just talk briefly. Then you
Okay.
just you
Okay.
control the whole thing.
Yes. Go ahead, please.
Okay. So pretty much when I spoke to Emeka, he was telling me that I need to come on board and give a little speech about dental hygiene. I mean, that's the broadest topic ever. Dental hygiene is like you can spend days and days talking about dental hygiene. But I'm pretty much just going to break it down into, the basics, what dentistry is all about. Basically, dentistry is all about fixing, decay or what we call rotten teeth. Um, it boils down to, when you have presence of any kind of pathology on the hard tissue, which is mainly the teeth, then it's got to be fixed. And believe it or not, dental decay or so-called dental caries is one of the most prevalent things in the world generally. There's almost nobody on the face of the earth, very, very few, that hasn't been to the dentist to get a filling done or cleaning done. So you could escape, having surgery done or, heart bypass or whatever, but very, 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 very few people have escaped going to the dentist. That's just to tell you how important dentistry is. So basically, we can break dentistry down into two parts: hard tissue, soft tissue. Hard tissue being the teeth and the bone, soft tissue being the gums and the ligaments and the periodontal ligaments that hold the teeth in place. Well, for today's purpose, I'm just going to break it down into how do we prevent tooth decay, tooth loss, tooth abscess, tooth pain. So for dentistry, for us to have any kind of tooth decay, three things have to be present. That's what I tell almost everybody. One of them is a constant. That's bacteria. Everybody's mouth has bacteria. Every single person's got bacteria in the mouth. So that's a constant. It's actually a very helpful thing to have those bacteria in your mouth. They're called anaerobes. They have their own part that they play, in your mouth. The other two factors that need to be present for you to have any kind of dental problem, dental decay, is pretty much a substrate, because now we have bacteria as a constant. The bacteria has got to feed. That's where the substrate comes in. And when we talk about substrates, we're talking about more about carbohydrates. Bacteria love that. So the byproduct of them eating or breaking down the carbohydrate is what actually dissolves the teeth. Then the third thing that needs to be present is time. So we're talking about for your teeth to start to break down, you have to stop one of these circles. Is either you stop bacteria from being in your mouth, which is impossible. It's either you watch the kind of food you eat, don't give them the substrate that they like, which is mainly carbohydrates. And the third thing is don't let that food stay in your mouth long enough for the bacteria to break it down to cause cavities. So like most of us, we break that cycle by brushing. The minimum time you're required to brush is twice, the morning and at night. Why the morning? The morning pretty much is more or less for social means. I mean, you don't want to go to your office or go to your job or go to school when you're talking to friends and you have that overnight breath, which could be coming from, even the stomach, the lungs, the tongue, or whatever. So morning brushing is so important for social reasons. But as far as dental is concerned, the night brushing is the most important for us. Why is that so? Because when you're sleeping at night, what happens? Your tongue does not move around. Like me talking right now, my tongue's moving around. I'm producing saliva. It's a natural means of your body trying to keep the teeth clean. But when you're sleeping, none of that occurs. As a matter of fact, saliva production is a whole lot less. So now, add to the fact that you didn't brush that night. So now you're providing those three things I just talked about. You have bacteria just present waiting. You have the food from the night that you didn't brush off. And now you're sleeping, you have time. When those three things come together in perfect unison, it's like the perfect storm. You're beginning to have decalcification, which will lead to breakdown of teeth. It's like you putting food out. Put food out, don't put it in the freezer. 2-3 days, it starts to rot. You got to fix it, you got to throw it away. So that's pretty much just decay and dentistry. And, I'm going to focus here on, replacement, extreme replacement. What I mean by that, tooth loss. I mean, if we catch the decay early, you can do a filling on the tooth. Filling means getting rid of the decay and replacing the missing part of the tooth with a filling. That's not invasive. But if the decay is pretty big, then we can't put a filling on that tooth. Now what we have to do is put a crown on the tooth. The crown basically means the decay is so big, you get rid of the decay. Now you're shaving that tooth down to about half the size of the original tooth. Then you can now take an impression of that tooth stub that's left in the patient's mouth and send it off to the lab to make you a replica of the way the tooth would have looked before the decay. That's a crown. Again, if it gets really, really bad, let's say this small decay becomes big and you can't put a crown on the tooth, then you're looking at what is called a root canal. Most people are scared of a root canal. When they hear root canal, they want to jump out of their chair. But it's not as bad as it seems. Root canal basically means the decay has gotten to the nerve or the tooth, because each tooth is a living entity. I mean, each tooth has its own blood supply, its own nerve supply. Each tooth is pretty much feeding off you because it has its own blood supply and all that stuff. But once a root canal is done, we're removing the blood supply from the tooth, we're removing the nerve from the tooth. So you pretty much have a ghost tooth. So the tooth is in your mouth, but in this case, it's not nourished like your other teeth because we've dehoused the bacteria in the pulp of the tooth. So that is why when you get a root canal done, you have to put a crown on the tooth. Even though you're trying to save a tooth, believe it or not, getting a filling done on a tooth is considered destructive. We're trying to save it, but it's still destructive. If you get a crown, yes. If you get a crown done on a tooth, yes, we're trying to save the tooth, but it's still destruction of the tooth structure. I just tell you the basic truth. There's nothing as good as what God gave you. I mean, man has tried to duplicate. In some cases, we've done really, really good, AI and all that stuff. But when it comes to the human parts and dentistry, what God gave you is pretty much the best, even though we come really close. Right. But if everything else fails, if the filling fails, root canal fails, then the next thing is extraction of the tooth. That's what I want us to focus on today. Tooth loss. So there are so many reasons why you can get tooth loss. The number one reason for tooth loss is decay, as we talked about. And the number two reason why you have tooth loss is it could be congenital. Some people are born without certain teeth. Some people don't have wisdom teeth, which is the most common tooth to be missing. Some people don't have the teeth in the front, they're called the laterals. It could be missing. Any tooth can be missing in your mouth. That's the second most common cause of missing teeth. But in this presentation, I want to talk about what options do we have if the extreme has occurred. We're talking about tooth loss. So now you have a space in your mouth. You smile, you have a big smile. People see this big gap on the side. And most people don't like that. Some people don't care, pretty much, Yes. And on the other hand, you could have a missing tooth in the front. So we're going to look at three options in a nutshell I'm open to questions. I'm just going through this. Dentistry is very broad. So please, you can ask any question outside what I'm asking today. That is fine. I'm just trying to lead us on to just a little pointer here as to what I prepared for. So if you have a missing tooth, you have pretty much 4 options as far as that space is in the bone that's missing, like tooth that's missing. The number one, not according to importance or preference, is getting an implant. So people are like, oh, what is implant? It's just like when you have a hip replacement, knee replacement, whatever it is. Implants are just a piece of titanium that is placed in the jawbone to replace the missing tooth. So that's what an implant is. It's a piece of titanium replacing the missing tooth, the root of the missing tooth. So we place the implant in the jawbone. We have to wait 4 to 6 months. I don't want to go very controversial here because I see you guys see some ads on television. They're like, oh, tooth in a day, implant in a day. Yes, it's possible. But if I put an implant on a patient's jawbone, and if I don't get like 20 newtons, 25 newtons of torque, of pressure, I can't load that implant. Loading means put tooth on the implant the same day. So we have to be very careful when people say teeth in a day, you walk out of the dentist. At the end of the day, if we can get enough torque on those implants, that means they're not stable. You're not going to get tooth in a day, even though our ad says tooth in a day. So you're stuck. So that's implants. The other thing is the bridge. A bridge basically means now you have a missing tooth, but on either side of where the tooth is missing from, you have good teeth. What does that mean? That means we can shave both teeth on either side of the missing tooth for crowns. Then instead of having 2 individual crowns on the opposite side of where the tooth is missing from, you have one tooth representing the missing tooth, bridging the gap between those 2 crowns. Remember what I told you earlier on that fillings and crowns are destructive. So why do people prefer implants? When you get an implant done, you're only messing with the space. We're not messing with the adjacent teeth. We're messing with the space that the tooth is missing from. You put the implant, which represents the root of the tooth. You put the crown on the implant. The adjacent teeth, we don't mess with them. We leave them where they are. But in the case of a bridge, we have to shave down the adjacent teeth to replace that one missing good tooth. It's like a bad house in a good neighborhood. It brings the value of everything down. So that's what a bridge is. And the good thing about the bridge and the implant is they're both fixed prostheses. Like I have patients that come to me and say, hey, I don't want anything I can take out of my mouth. It reminds me of my grandparents or whatever. I mean, justifiably so. Nobody wants to take teeth out of their mouth like you take off your glasses. I take off my glasses if I go to bed at night. I don't take off my glasses, I take off my teeth.
I can relate.
Yeah. I don't take off my glasses, take off my teeth.
Yeah.
So they want something fixed. So implant and a bridge are fixed. Then the third option is a removable prosthesis, which is pretty much the one you take out and put in. If you see some old folks, they have something they take out of their mouth, that's a removable denture. The good thing about that denture is don't knock it off completely. What I mean by that is it's the cheapest prosthesis out there to replace missing teeth, and it is functional. The most important thing about teeth is functionality. If you don't do anything, that space is non-functional because you can't really chew with it. And before long, your teeth starts to shift and all that. So if you can't afford or just don't want to get a bridge and an implant, a partial denture is a very good prosthesis to have so you can function. Your cheeks don't sink in case you have missing tooth in the back. You keep your facial profile. You're able to chew better and your teeth don't shift. Then the fourth thing about missing teeth is this, which most people don't really talk about, but I'll talk about it here, is doing nothing. So you might say, oh, Chris, you're a dentist. Why are you bringing doing nothing as an option? I mean, it's unconventional to say that, but one thing about the human body is adaptation. I mean, let's look at in those days when they had no glasses.
Oh, yeah.
People still able to see and do what they had to do.
Yeah.
So don't commonize the fact that, yes, you cannot afford implants. Yes, you just hate the dentist. You don't want to get anything done. You just don't want to hear anything about the dentist. But over time, nature will try to fix a problem. It's like if you have a broken bone, if you don't go fix it, that bone is going to heal. You might have double joints,
Yeah.
You know, instead of a single joint, you might have double joint in one spot. But guess what? That bone is gonna heal. Okay, same thing with teeth. You don't do anything. Like in Nigeria, I have friends, cousins, no teeth. They've adapted. They'll go into competition with, in an eating competition with you, and they'll out-eat you. So listen, not doing anything is also an option, but it's not advisable to do that. So that's just tooth loss in a nutshell. Again, I'm open to questions from anywhere in dentistry. That's my field. It doesn't have to be tooth loss, whatever it is.
Yes.
Just throw it at me, and I'll go from there.
Okay, let me start. So, question number one.
Yes.
Why is it so expensive to go to a dentist? That's question number one. Jesus Christ. Like what tool, what is the material used for it to be so expensive? That's why people just say, just take it out, just forget it, just take it out and I'm done. I don't want to come back or visit or do this. Why is it so expensive? Please break it down, because if you break it down, you might help people see the picture of why that is, you know? So please.
Okay. I'll try my best, the best I can.
Dental school, number one.
Sorry?
Wale, wait, Wale, please, wait.
Okay. The reason why, to my belief, why it's expensive, I mean, there are several factors, but let me break it down to the ones I think according to importance. Number one is, let's face, I'll say dental school. Okay, I went to University of Benin, and I spent 6 years in the University of Benin in Nigeria, the dental school. The amount of money I spent in those 6 years to go to dental school in Nigeria is not even up to the money I spent on one term in dental school here in America. Again, let's face it, America is a capitalist economy.
Yeah.
You have to recover your money somehow. You know, that's what's gonna happen. So number one is dental school is expensive to attend. I mean, you're looking at easily a $250,000 debt by the time you're done in dental school. And this is all in your head. It's not like you bought a house or something. This is like all the knowledge you have. So yes, $250,000. We dentists, we want to recoup our money. We have a short time. The banks are on our neck. We got to get it done. That is number one. That's one reason why dentistry is expensive. The other reason why dentistry is expensive is very simple. We all know that. Insurance. Insurance controls the shot in America. I don't want to go into details. I'm not a politician, but I tell you what, insurance will tell you what they think should be the fees based on reimbursement or how much they want to get from you and all that stuff. So they have certain guidelines or parameters they follow. So even before you come into my practice, let's say you're Blue Cross Blue Shield. I take Blue Cross Blue Shield, I take Aetna, I take United Health. They already have, because I'm in contract with them, they already have set fees. So you can't come to me and say, oh, Emeka, you're my buddy. Pay me $200 for this crown. That is malpractice. I can't say because you're my friend, I will tell Mr. John to give me 500 or 5,000. Then I'll tell you, Emeka, to give me 1,000. It has to be uniform across board. That is considered unethical to do. So these things are already preset by the insurance. So when you come in, we're slapping you with a price already predetermined by your insurance. Okay, and the problem with that is this. The insurance might say your total amount of money you have for the year. For example, Emeka, let's say you have Blue Cross Blue Shield. They will tell you the maximum amount you have to spend for the year is $2,000 for the whole year, 365. But if you come to my office, if I take x-rays and pictures and exam, almost a quarter of that money is gone. This is without treatment. So by the time I now do treatment for you, if it's something big, you're out of benefits. So now I'm hitting your pocket directly. You're going to pay for the treatment your insurance will pay for because you've exhausted your benefits. So that is one reason why it's expensive. And the last reason why it's expensive, according to, there are many, but these are the top three, is the cost of the material. Dentistry is different from any other kind of medical profession for a reason. I have medical friends. I go to them, check my blood pressure. They write a script. I go to the pharmacy, or they write a script. I go to the lab. In dentistry, you are a direct consumer. I'm putting a filling in your mouth. Yeah, I'm not sending you to no lab. You're a direct consumer. I'm taking a tooth out. You're a direct consumer. So my friends can just stay in an office and send me anywhere they want to go. All they did is a stethoscope and all that and read my lab results. We are the one doing everything in one house. So that is why it is expensive, because most of the stuff we use costs money, and I can't do a filling for you for free because I'm putting something in your mouth that I'm paying for, and I got to recover that money. You can't be fixing somebody's car or somebody's roof for free. That's what dentistry is like. That's why it's expensive, because we want everything we're doing for you to be paid for while we're getting that done. So those are the three main reasons, I think, why dentistry is a little expensive. Yeah.
Thank you so much. I think my dad wants to say something. He has a question.
Sure.
Hey, Dad, you want to say something?
It's not a family monopoly, oh. We don't agree. One family per 30 minutes.
Hear me now for you. I think he raised his hand up, actually. He raised his hand up.
Okay, because your father, I will let him talk. But you can't talk again.
Oh, where is he? Oh, okay. I think he's in Nigeria, so I think, it's very late over there. Daddy, do you want to say something? Okay. Who had Rhoda? Please go ahead.
Chris, I had a question for you. So I actually took out my wisdom teeth, but one of them, I don't have it. And it's not that I don't have it. When the doctor did an x-ray, he said that I do have it fully grown underneath the gum, but it's too close to the nerve, so they couldn't take it out. In this case, I never knew before that the teeth can be fully grown underneath the gum. And is this like something that maybe in the future someone should worry about?
Yeah, that's a very good question. Who am I speaking with?
Rhoda.
Oh, this is Rhoda.
Okay, Rhoda, thank you for that question. That's a very good question. Wisdom teeth, it's a little tricky. The reason why I say that is this. We're in Nigeria, we're not too crazy about extracting wisdom teeth unless it's hurting you or thereabout. But here in America, wisdom teeth is something we dentists hate to see, even if it is fully erupted. Fully erupted means you can see it in your mouth, you can clean it. We just want to get it out. That's the training they gave to us. When we go for oral surgery rotation, in dental school, the oral surgeons tell us, wisdom teeth, send them to us, send them to us. So when I got out of dental school, the first thing I want to do when I see wisdom teeth, even though it's up there, you can keep it clean. I say, go see that oral surgeon. But it's different. Like in your case now, I think you're dealing with an impacted wisdom teeth. What does impaction mean? Impaction means you don't have enough room for that wisdom tooth to erupt. So you now have the wisdom tooth underneath the gum in the bone. Again, I'm not going to go through types of impaction. There's mesial, distal, whatever, horizontal. Let's forget about that. But it's impacted means it cannot come up fully. That is why before we take a wisdom tooth out, we have to take an x-ray that goes around your head called the panorex. That would tell us where the nerve is. So it's not in every case that the dentist will recommend you take a wisdom tooth out. Why do I say that? Because there's a nerve that comes from the base of the skull, and that wisdom tooth, in most cases, sits right there on top of that canal, or maybe away from it. So sometimes it's not uncommon for you to have somebody take a wisdom tooth out. I have a client who took a wisdom tooth out. 6 months later, it still feels like the person is still numb because of paresthesia. The nerve's been damaged. So yes, in your case, what I would suggest is let a good doctor look at it. Sometimes he might even suggest that it's not worth going to extract the tooth based on the things around it. My experience in America during my residency, we had a patient, of course, you must have known this, he had a gunshot injury. And the surgeon, because this is maxillofacial surgery rotation, the surgeons didn't want to go in there and do anything. And me, I was curious. I was like, this guy's got pellets. They're like, where it's at, it's safer to leave it where it's at. So the same thing with, yes. So the same thing with wisdom teeth. Let the surgeon or the dentist look at it critically. If they see there are too many vital structures close to it, my sister, the best thing is to leave it the way it is. Sometimes you might never even have any problem from it, but it has to be assessed by someone that knows if it is worth going in there or not. Because at the end of the day, as I said before, dentistry it's a business.
Yeah.
Okay. I don't know if that answered your question.
Yeah, I did. Thank you.
Okay.
I have a question.
Hey, Sam, go ahead.
Actually, I have several questions. The first one is, based on the information that you provided, obviously cost is an issue. But what I'm trying to ascertain is, because people have dental challenges, and a lot of times, especially in less affluent communities, we're not able to afford the cost of whatever dental work we need to get done. So so as dentals, like for example, I know some of my clients, they will go to the various dental school and get work done. So what would you recommend in terms of mitigating the costs for your dental work or whatever the case may be?
Okay, thank you so much. That's a very good question. Well, I think this depends on the dentist per se. What I mean by that is, I have this running joke. My practice is in Greenville, Texas. The median income in Greenville, Texas is about $34,000. I used to work at Rowlett. The median income was about $75,000. Next door to Rowlett is Rockwall. Median income is about $80,000. So Greenville is not really rich. So I do dentistry sometimes, out of what I can do to help the patient. Again, not everybody would do that because dentistry is a business, but it depends on the dentist. Dentist, we can mitigate that by maybe the dentist wanting to help. It will cut his costs, considerably, so he'll be able to help. Then the other option is what you talked about is the dental school. I love dental schools. It's one of the best places to go. But have you ever been to a dental school to get a filling done? It's a whole day event. I was a dental student. We have like 16 of us in one group. When you see the patient, you numb the patient, your instructor comes in. She goes to see, dental student number 2, number 3, number 4. Then when he comes back to you, you now prep the cavity, he's going to look at it. So it's a whole day event. Yes, the dental school is cheaper relatively, but at the end of the day, the amount of time you spend at the dental school to get a filling done compared to what you're saving, to me, I don't think it's worth it. But if that's the only option, then that's the only option. Then the other thing is, in Greenville, Texas, we have a community dental practice, a community dental center. What does that mean? If you have patients that can afford dentistry, maybe insurance or finance or whatever, they should look for community dental centers. Most places have it. What they do here is the dentistry they perform is income-based. So they do have income based. So if you're making $30,000 a year and you need to get a crown done, that's $1,000. There's a way, I don't know the formula now, but there's a way they can titrate that to match your income. So that way you're not being hit out of pocket. You spend $1,000, which is almost a year's income. Which is a 1/30 of your year's income on a single tooth, while you still have other things to do. So those are the little, and of course they have churches too that do mission trips and all that stuff. That can also help to mitigate that. But honestly, besides that, it's pretty much it's not easy. It's not easy, if I may say that. It's not.
So basically, what you're saying is anybody could still get a dental treatment. It doesn't matter the zip code, and it will be for a price that they could kind of afford, right?
Yes. If you go to a community, you have to go to, like, they have one, it's called Carevite. It's in Greenville, Texas. Like,
Can somebody write that down here? Carevite, you said?
Yeah, Carevite, Carevite. So they can, do treatment based on income-based treatment. Besides that, though, it's pretty difficult to find most places that could do anything otherwise. It's not easy. So you have to look for those kind of places carefully. If you can afford regular dentistry.
Okay.
And then I have one more question.
Okay.
Sure.
So when you're choosing a dentist, like, what are some of the options that you should utilize? I mean, someone referred me, but let's say someone doesn't have that option. What are some of the options that you should look for what are some of the criteria you should look for when you're choosing a dentist?
Well, that's a very good question again. I mean, you have like the best questions. But let me tell you what, the way someone told you about your dentist by referral, that's the best. I tell you this, when I opened my practice in 2010 in Greenville, man, I was looking at the doors praying for patients to come in. I mean, I took out this huge loan. I'm a young dentist. I have to make it. The banks are breathing down my shoulder, but I put ads on the newspaper 3 days a week. I was in the newspaper. And if you go to the movie hall in Greenville, you'll see me there. I had a billboard on I-30. I mean, I blanketed this space because I needed to get patients in. I needed the foot traffic. But guess what? This was like 2010. In the last 4 years, I've not sent out a single ad. I've not. Because right now, I feel my practice has become like a landmark in the community. What do I mean by that? Word of mouth, exactly what you just told me. That's the best way to find a dentist. Word of mouth. And even when I see my patients, like the really good ones, I always tell them, listen, Ms. Jones, I want you to send me someone that's like you. That's the word I use. And they laugh over it. I'm like, yes, if they're not like you, don't send them to me. I don't want to see them. You know what? It's like a joke, but she laughs over it, but that thing sticks in their memory. And they send people to you because of that simple statement you just made. So word of mouth is number one. Then the other way you can see dentists is through your insurance. Like I have some patients that come to me and they're like, oh, I have Blue Cross Blue Shield. And I ask them, hey, I live here in Dallas. Who can I see? They take your zip code. They give you a list of 10 dentists or 20 or whatever. They're like, you go choose one. Do your homework. So that's the other way you can look for a dentist in your area. Then, of course, I think that's the other way you can look for a dentist in your area. Pretty much word of mouth and that. Then the last thing is also the internet. I have, if you go on internet presence now, I mean, you can book an appointment online, you can do whatever online, but the internet, I mean, this is not a place I should be saying this, but it's pretty much rigged. Like some big chains that you hear about on the radio. How can you have 2,000 reviews and not one person hates your guts? It's not possible. I mean, if you read my reviews, it's all really nice, but there are going to be some people that hate my guts on there. So if you're seeing a dentist that has 2,000 reviews and 2,000 people love him, it's rigged. So that's just pretty much the way you can look for dentists. I mean, I don't know, besides this three I just talked about.
Keeping it real, man. Keeping it real, Chris. You have to keep it real sometimes, man. It's true.
Yeah, sure.
It's true. Sam, are you good? Let me go to Yemi.
Thank you very much.
Oh, you're welcome. Thank you.
Mr. Yemi, please go ahead. You're on mute.
Yeah, for some reason, man. Yeah, I think I'm just joking. I was gonna say you put me on mute. Okay. I had to write my thoughts down. The first one is like, as a dentist, what can you do to encourage people going to the dentist? Because nothing against you personally. I don't know you, but we hate dentists. There's a phobia that a lot of people have. I know myself. I hate going to the dentist. That's my first question.
Okay, yeah.
Chris, did you get it?
That question. Yeah. He said he has dental. Well, this is it. Dentistry has changed a lot. When I was in Nigeria, I had a tooth taken out as a boy. I tell you what, that wasn't the best experience ever. It has changed a lot. A lot of stuff has changed. Let me give you an example. I like to go outside dentistry and come back into dentistry. I know in those days, when they had trench foot, World War I, and a soldier had to go through amputation. Guess what? Guess who the best surgeons were? The ones that could amputate the foot the fastest with a saw. Those were the best surgeons. We're talking about long ago. We're talking about World War I, that period. I mean, you can read this. But now, they're doing heart surgeries now without even opening the people up. You see what I'm saying? Dentistry is also evolving. The anesthetic we use now is totally different. I tell you what, I mean, from what you said, I always tell my patients this. I tell my staff that too. What makes a dentist good? What makes a dentist bad? You might be the best dentist. I mean, you know your craft. If a patient feels pain when you're walking, you're the worst dentist ever. Even if you are cum laude in your class, patients don't give a damn about you being cum laude when they feel pain. Let's say you're at the bottom of your class, you barely out of dental school, but this dentist fixed your teeth, you didn't feel any pain. Guess what? Now you are cum laude. So dentistry has changed. The procedures have changed. What we are working on now in the dental profession is patient education. Someone like you and me right now, I understand your fears. It's very legit. We're not going to downplay it. We have to educate our patients about the advancement in dentistry. There are things we can do right now. Like in those days, if you notice, they used to have kids. They used to what's called the papoose board. I don't know if you're familiar with papoose board. You tie the kid is wrapped up in a blanket, or like roll the thing in the blanket like a burrito. Then when the kid is screaming, they would put a mouth prop in the mouth. So the kid can scream, but the mouth prop is in there. And now we're working on the teeth. I mean, this is so barbaric. It's not that way anymore. Nobody does that papoose board anymore. I've not seen it. Okay, so now we can refer you to a pediatric dentist. What can he do? He's better trained to handle kids. We have sedation that are anxious like you. We can do oral sedation. If oral sedation is not going to work for you, we can do IV sedation. So there are other things we can do right now that will help alleviate, or bring down the anxiety that most patients have for the dentist. And trust me, the dental community, we are aware of the phobia. We're working on it. Find a dentist you love. That will make it easy too. Make sure you like your dentist. If you don't like your dentist, leave him. Because if you like your dentist, it brings that fear level down and makes you more comfortable for you to want to go see the dentist.
Wow. I feel like I want to go there now. Huh?
I'm not done.
Wait.
I want to respond to Yemi's question real quick.
Okay.
Because I might lose signal.
Okay.
Well, what will make you go to the dentist? What's one thing that'll make you go to the dentist is the moment you have a very bad cavity, then the dentist will be your best friend. So I'm speaking from the example because, for example, Dr. Chris is my dentist. So I've been knowing Dr. Chris for over 5 years now. And the moment I was having a very bad cavity, and the moment I got insurance, I decided to look for a good dentist, and it was Dr. Chris that helped me out because due to my cavity, I lost weight. I could not eat anything sweet. But after visiting a couple of times, having a deep clean, and I started following regular procedure, visiting on the regular with my insurance and everything, which my copay wasn't that much. Every time, I think to follow up cleaning was like $30 or $25. I can't remember. After that, I noticed my cavity was all gone. I could take sweet, eat candy, and that was it. And we became good friends ever since then because it saved me. Because when you have a very, very bad cavity that gets to your brain, the pain and the hurt is nothing to play with.
Gets to your brain.
Yeah, I mean, there was a time I had to pull out one of my teeth a long time ago because it was exam period. And I could not sleep, I could not read, I could not meditate because of the pain in the cavity. So yeah.
Woo. Okay.
Well,
Yemi, what's your next question?
Check.
Yeah.
Okay. My next question is one thing also too. I believe customer service. I think Dr. Chris, talked about it. Customer service. One thing also too is that why do dentists always, because I went to a dentist. I think she's in, this town is small. Because I got a Groupon and it was like, hey, free dental exam and cleaning and all this kind of stuff.
Mm-hmm.
So he bought it on Groupon. So I went there only for me to go there and she did the exam and everything. So I was asking, then she did the whole exam, I guess, and gave me the whole what was needed in my teeth, right? Then she was like, so I was like, at that time, I think I just changed company. So I was like, hey, I want to know what insurance was good. And she was always hesitant. She was saying cash. Why do dentists play gimmicks like this?
Well, what do you mean by she was saying cash? She didn't want to.
She was saying
I
I was asking her for a recommendation. She was saying, "Oh, cash is much better." Because I know there's more incentive getting cash.
Yeah.
Well, I'll tell you this. Cash is better for anybody. I mean, for you, for Emeka, for me. So not to make light of your situation. I tell you what though. There are some insurances there. I'm not really I have two ladies in my office that do insurance. But do you know how long it takes the dentist to get reimbursement from the insurance? I could get a filling done for you or a crown done for you in, let's say, January. Before the insurance will send that money in, maybe I'll be getting somewhere around March. So the money I'm using now to pay my patients or my staff is pretty much what I've worked before. The one I'm working now today is for the future. So the reimbursement rate is terrible. We have to chase them down. You know, sometimes you tell the patient, I fight insurance all the time because I do a crown on a patient. The insurance is saying you shouldn't do a crown on this patient. Mind you, this insurance is in Omaha, Nebraska. I'm here in Greenville, Texas. I see the patient. I have the x-ray. I see everything. You can't be on the phone looking at this x-ray, not even physically seeing what I'm seeing and telling me what the treatment should be while you are out there I just chose Omaha. If you're anybody from Omaha, don't be offended. But you're out there in Omaha telling me what the treatment should be. So the ultimate goal for every dentist is to be out of network with the insurance. So that is why I'm guessing that is what that dentist is saying. She doesn't have to fight with the insurance if you pay her cash. If you come to my office and you give me cash, that's a good day for me. Why is that? I don't have to call the insurance and chase them for 60 days to get paid. My staff is not going to wait 60 days to get paid. So I'm thinking the lady should have told you some good insurances to go to, PPOs, Blue Cross Blue Shield, Delta, Humana, United Health. There are lots of good insurance. She should have told you those ones. Then she would have told you, but I prefer to pay cash if you can afford to pay cash if you don't have any of those insurances. Mm-hmm. That's just where she was. That's just the mistake she made. She should have been open to you and tell you other options, but I prefer cash if you can pay me cash. And that's it. Nothing wrong with that.
Okay. Just last question and I'll make it quick. Okay. I had two questions, but I'll just put everything in one.
I have one for you. Yemi, also. Go ahead.
Okay, my question is, what I've noticed is that, I guess I'm going to be honest here. What I've noticed here is that, like, women especially, they invest money on makeup and so many things, and I guess it goes for guys too. But people don't. You can see people. I've had co-workers and people I've known. Their old teeth is all messed up, and they spend money on cars and all this. I know it's a personal decision, but my one thing is that why do people don't invest in dental health? And one last question is a yes or no. I guess you can answer this question. Does lack of dental care cause cancer? That's all the questions I have.
Okay. Yeah, the first question you asked, why people don't care. Again, you're right. You asked the question and you gave the answer. It's a personal decision. Okay, if you think having a toupee, if you're a guy, is more important for you, than having brown teeth or cavities, you're gonna get a toupee. If you're a lady, if you think getting a plastic surgery done is more important than you getting your teeth fixed. So it all boils down to personal preference. Again, that's why we're doing a lot on patient education. That's just the bottom line. Prevention is better than cure. We have to educate the patient what is going on. Your health is important, but dentistry, the reason why people don't really take us serious, again, I'll be very honest with you, dentistry is considered elective. What I mean by that is, if you miss a job until you went to the dentist, you might not get paid, but if you say you went to the doctor, your medical will kick in for those days that you missed. Because dentistry is considered elective. That's why most companies don't even offer you dental, because it's elective. They know you're not going to die because your tooth is hurting. You take some antibiotics, you're going to be fine. So back to that question, patient education is the key there. Then the last question you said about not taking care of your teeth can cause cancer. Hell yeah, it can. It's a predisposing factor to a number of, there are a number of cancers in the mouth. I don't want to go through white lesion, red lesion, all kinds of lesions. We're going through pathology right now, but we don't want to go that route. But yes, just last month, there was a patient of mine. We looked under his tongue, we did everything else. We saw a little spot. I mean, he takes good care of his teeth. This guy's not like doesn't brush, good care of his teeth. But it turned out to be, the cancer on the side of the tongue. So we referred her to the oral surgeon, and she's going to be taken care of or whatever. Yeah, so it is a predisposing factor if you don't really take care, because again, as I said, your mouth is full of bacteria. And once those things are activated the way they shouldn't be, you are predisposing yourself. It's not like dirty mouth will cause cancer, but it's a predisposing factor. Like, for example, I give you an example. Now, before you can get like a heart transplant done, a knee replacement, a hip replacement, you are required to get a dental clearance. Why? Because they found out that there's a correlation between periodontal disease, which is gum disease, and failure of prosthesis way down away from the mouth. So now, without a dental clearance, you won't get a heart replacement, especially with big institutions like UT, Baylor Scott and White, because they know there's a relationship between periodontal disease, heart failure, prosthetic failure, all that all comes together. It's a big predisposing factor to a whole lot of stuff, if that makes any sense.
Wow. Thank you for that. Thank you. Yemi, my question to you is, so now, before I say that, I want to thank you, Yemi, for saying that, because the reason why a lot of us are here is because we need to educate ourselves. You see, some people never knew this. Now they're knowing this. They might make a change for the better of their health, right? It probably will happen. And I'm actually thinking about myself. But so, Yemi, with what you've heard now, do you think you will change your thinking of maybe giving, Dr. Chris a try to get an examination?
Definitely.
Right? It's changed your perception of, it's going to be very painful and it's going to be this and that. But you also understand why it is expensive, because of how much it costs, over 250,000 to get it done, to finish the class, but also the other processes that have to get in place and how long it takes them to even get the money from insurance. So it kind of gets you to understand how much time, energy, and effort has been put into it, so that when you go back there, you probably have a better or higher respect or knowledge for why you're paying this money, right?
Well, my own thing is, like, I'm not a socialist. I'm a capitalist just like the next person. I always believe that everybody are in there to make money. But when I feel it's getting on the border of someone's trying to take advantage of you,
right.
Then that's when transparency is key. So that's what I felt, when I went to that dentist.
Don't worry, Yemi. Let me know when next year going. I'll come and hold your hands.
Yeah. Okay, hold on. So we have Beatrice. Yemi, thank you, man. Beatrice, what was the question for Dr. Chris?
Yes, good evening, everybody. Can you hear me clearly?
Yes, I can.
Perfect. Thank you, Emeka, as always. Dr. Chris, thank you so much for your time. So my question is actually sort of a follow-up to what Yemi, it's almost like he took the question that he had was around the fear and the stigma around going to a dentist office. And I'm hoping that you can not only help all of us understand, but also for myself with some background around sterilization of equipment, understand, the processes or sort of like the steps that are in place to sterilizing equipment, because I do know, like, whenever you go to the dentist office, you sometimes see them touching the light and the light is not lined, and then they go from one room to another, so washing the hands. So you're sitting on that chair, there are things going on through your head, and then there's equipment that's already open, the cassette is open, ready for you to be given care, and then there's just questions going around your head. But of course you're going to receive the care. After the care, then you're going to have, oh my God, I hope I don't get infection. So what processes, especially in your practice, because I'm a big supporter of like consuming products within our community. And so I'm hoping that you can share with us what you have in place for infection prevention. What processes or steps do you go to ensure that if you do find that there's an infection, how do you mitigate that? So thank you.
Well, thank you so much. That question is very broad. I know you must have heard about OSHA. Okay, so there is a standard. This is not standard for Dr. Chris or anybody. There's a standard that the TDSDA, Texas State Board of Dental Examiners, a minimum standard, if I may use that word, that is expected from every dental practice, a minimum standard. What does that mean? Number one is, in addition to universal precaution, like in my practice, if somebody comes to me and says, and they mark on their medical history form, history of, maybe AIDS, hepatitis, that's not the time for me to say, oops, AIDS, hepatitis, we're not seeing this patient's got to go. No, that's where universal precaution kicks in for every patient. And there are set guidelines for that. I can't go through the details that we do in my practice or whatever. What I know is every year you have to be OSHA certified, which you have a certificate, because those OSHA guys, these guys, they wear suits. But when they come into your office, they can shut you down in a heartbeat. No questions asked. And the reason why they shut people down is cross-contamination, infection control. Again, the main thing for infection control, as far as the instrument goes, is, for example, again, it's a big topic. I'll just make it nice and sweet and simple. You said something about the cassette. When you said the instruments and the cassette, yes, that cassette is what we put in a sterilizer. The sterilizer, there is a spore test strip. Because believe it or not, when I was in Nigeria, I mean, God has helped us in that country. We'll boil instrument in water, and that is it. Guess what? Some spores will withstand over 100 degrees centigrade. Water boils at 100 degrees, right? We know it's boiling because it's bubbling. Some spores, that's just a cold day in the Arctic. They're well and alive. You see what I'm saying? So we put this stuff in the sterilizer in the cassette. There's a strip there that tells you, it's called a spore test strip. And you have to mail it to, there's a place we mail it to. I don't want to give the name. Then they will now send you the result back, and you have to catalog that result. What I mean by that, these OSHA guys can come into your practice. Let's see your spore results for the last month, a year ago, 2 years ago. You can't say, oh, you lost the strip or whatever. I mean, you can get it back from the company, but you have to catalog it. I tell you what happened. A friend of mine, same thing, sent a spore strip. The results came, he failed this test. This is not OSHA. He knows. He shut it down right away. You don't have to beat about the bush or whatever. He shut it down. When he shut it down, called the technician. They came, checked the autoclave and all that, found out what the problem is. He had to send that on that spore strip to get a positive for him to start saying, okay, yes, we're free to see patients again. So there are so many things there you could do to mitigate cross-contamination. But universal precaution is still the standard for everything that we do. Again, feel free. Like your dentist must have what they call barrier tapes. What does that mean? You see him touch that light as you were talking about. There's usually a blue tape or white tape or yellow tape on that. That's a barrier tape. After each patient, you strip the barrier tape. A new barrier tape goes on after you clean the chair for the next patient. That's why the dentist sometimes can pull the light down. There is a barrier tape. So I'm just talking about what needs to be done. I don't know about other people's practice, but I'm just telling you what should be done to mitigate cross-contamination.
Right. Quick question on that, Doc. So how about if she wants some kind of closure for her own personal benefit, where she's uncomfortable and she doesn't know how to just say it all out. Hey, you guys are touching this. Is it okay for her to maybe whisper to someone, the nurse or the doctor, like, hey, please, do you guys mind changing your gloves or changing this? I saw something I'm not comfortable with, Would that also help? Because they need to get
Yeah,
closure.
that would help. It depends on the practice. That would help. I tell you what, when I used to work for a big chain, I'm not going to call the name, years ago, we were limited to three gloves per patient. Again, people forget that dentistry is a business. I mean, we want to save your teeth, but I still have bills to pay. But we're limited to 3 gloves per patient. Though you can exceed it, but it's not advisable. So yes, the patient can always tell whoever it is, the assistant, hey, I hope that is, I saw you touching this with your hand and you're touching the instrument. Be very polite about it. Ultimately, in Nigeria, there's this saying in Nigeria that you go take shame, drink poison. You cannot be like, oh, I'm so shy. Then you'll be drinking poison because you don't want to stop. Don't take shame, drink poison. If I may use that word.
Say it out. Yeah.
Thank you, Emeka. That's the word. You gotta let them know. Let them know. What's the worst case? If you're not happy, get up and leave. Look for another dentist.
Customer is always right. Right? Yeah.
Be comfortable with your dentist. Feel free to ask questions. I have patients that I tell them they have gum disease. They're like, how come my dentist didn't tell me, and I've been going there for 6-7 years? I'm like, well, you can always go back to him to continue your another 6-7 years with the gum disease, because you're not asking questions. You have to ask questions. It's important, and you have to probe too. If you're not too comfortable, please probe. This is America, it's a free society. If you don't like them, they fire you. And if I don't like you as a patient, likewise. So that's just the way it works. But don't hold back. If you have concerns, please let it be addressed. It's important.
Yeah, very good. Beatrice, you're good, right?
Sorry, yes. Yes, thank you. Yeah, thank you very much. And you kept it simple. And so I appreciate that. I think we really need this education, because majority of us don't go to the dentist because of those type of, and the stigma, like you said, back in Africa, we're just now raising first generation Americans, some of us. So we have that stigma from Africa. So this is important to know. Even though we know we have the knowledge, we still need that enforcement. So thank you.
So you're welcome, Beatrice. Thank you.
Thank you, Doc. Eunice wants to say something. Eunice, are you there?
Yes, I'm here.
Hello.
And I want to thank you so much, Emeka. Thank you so much, Dr. Chris. I have gained so much knowledge just from being on this Zoom call today. So I have multiple, I guess, experiences with the dentist. I like everybody else has said, it's always fearful, experience most of the time. But then it's one of those things that's needed to be done. So very recently, I had one of those wisdom tooth, taken out. And it was one of those that was under your gum and, you couldn't see it. But then I had a crown that was placed right next to, the wisdom tooth. So then I started getting some infection in between, I guess, the wisdom tooth that was not erupted yet and my crown. And so I was, for like almost 4 or 5 weeks, I was only able to eat from one side of my mouth because of so much pain. I was taking hydrocodone, Motrin every 6-8 hours. It was ridiculous, but I had to see a dental surgeon. And sometimes it takes time to get an appointment with one of those, So finally, eventually, cut the long story short, they eventually took out that wisdom tooth. And like you said, I still have some numbness on one side of my mouth, actually my bottom left lip, but the doctor said it might take maybe up to 6 weeks before it clears off. It's been about 4 weeks. I mean, I can tell like it's getting better over time. So I'm hoping it definitely clear out. Now, the one thing I wanted to just mention, I remember them, I'm a nurse. And so I remember going to nursing school, they talking about, an infection from the tooth would lead to pericarditis, which is an infection to your heart. So that was what drove me to having it done. I was very, very scared and skeptical, but then I was already on rounds of antibiotics, maybe 3 or 4 times for that before I finally decided I need to go and get this done. So I'm really grateful for this education session, but sometimes, the fear and what could happen worst could happen if you didn't take care of that small problem is what drove me to having it taken out, but I thank you so much for this session. Thank you.
Thank you. Thank you, Eunice. The aim is just to get better, to use knowledge to be a better person. And that's why, I mean, Dr. Chris is talking right now. He's been a member here in this group, just watching what's happening. And we have more people who are going to come and talk to us. But this is enlightening. I'm learning also. We also have some more questions, Doug. Some people, do you have, okay, so let me say this to Beatrice. I see the message since she left. I sent his resume to everyone, unless you didn't get it, where you see his information in there. So you could just get a good understanding of who you're dealing with, So I think, that should answer your question, Beatrice. That other question said, does anyone have anything else they want to say?
Yeah, can I chip in on what Beatrice said? I mean, she's a very smart lady.
Yeah.
Again, what she said about that pericarditis is exactly what I alluded to earlier when we started discussing. What I was saying, that sometimes she could have dental disease, I mean like gum disease, periodontal disease, and in some places they won't even do like a heart valve replacement. They won't even do a hip replacement, a knee replacement, because the bacteria that causes gum disease, once introduced into the bloodstream, causes a response that would make your body try to fight all these prostheses that have been put in your body. So she is absolutely correct, because it could lead to valvular heart damage. If you have gum disease, you're not taking care of it, or in her case, she was on antibiotics for so long. Some people just think antibiotics is so, they eat antibiotics like M&Ms. It's not hurting you now. You place on antibiotics, you forget about the dentist. We don't see you again. Then 2 months, another antibiotics. 3 months, another antibiotics. Guess what? Antibiotics is good, don't get me wrong, but it is still, your body has to detoxify it because it's not natural to your body. You know what I'm saying? So now you're putting your body through the stress of detoxifying this stuff, especially pain medication, hydrocodone or whatever, over and over and over and over. Why don't you treat the source of the pain? Why do you have an ulcer all the time and you keep treating it and you don't want to treat your diabetes? It doesn't make any sense to me. Treat the diabetes, the ulcer will go away. So that's a very good question that Beatrice talked about, and I really like that. Thank you.
Yeah, thank you, Doug. Wale, did you want to say something?
Yeah, I have something to say. Okay. Dr. Chris, I know most of us are from Africa. We have that stereotypical way that we tend not to go to the dentist, and even when we are sick, we try to wear it out, which is another reason why most of us don't go to the dentist. So I have a question, because sometimes I see some people that have discolored teeth, funny looking teeth, bad dentures, everything, but yet it looks like they're not going through pain, or they don't know their teeth are decaying. I mean, exactly what's going on? Is it like their teeth are still surviving, they don't feel pain, or are those teeth still alive? I mean, how are they able to endure or live so long with such a decayed teeth that we see with the brownness and everything? So what's really going on in their mouth? I mean,
well, that's a big academic question, but I'll make it as simple as I can. Remember when I said earlier in the meeting about adaptation? That is something that we've commonized. I mean, these days, I might know this in Nigeria. If mosquito bites you, it's gonna hurt. It's gonna hurt for days. But if it happens in America, guess what? Because of that pain we're feeling, we're at the emergency room. The next day, we're calling the doctor. Let me tell you something. This might come strange to some of you. Pain sometimes is good for you. I'll take a tooth out on a patient. Guess what? The patient calls me the next day. Doc, where you think the tooth out is hurting from? Guess what? It's trauma to the area, but it's trauma by a dentist. It's like you going to the bar, somebody punching your mouth, your teeth flies out of your mouth. It's the same thing, but this is what? I have a license. I'm taking your tooth out with instruments. It's still trauma. It's controlled trauma. It's going to be pain with controlled trauma, just as it's going to be pain if like you're involved in a bar fight. So adaptation is what is going on there while what you're talking about. People have adapted to it. And sometimes too, your tooth, let's say the initial phase, let's say you have a cavity, it's got into the pulp nerve of the tooth, it starts to hurt real bad, real bad. You take antibiotics. At some point, that tooth is going to die. What do I mean by that? It will quit hurting. So it has gone from an acute inflammation. I don't want to go through all this medical jargon. It has gone from an acute inflammation now to a necrotic state. If your tooth is necrotic, your tooth could be rotten, bombed out, black, brown, purple, everything. You have no pain because that tooth is now necrotic. What does that mean? If the tooth is dead, but guess what? Those kind of teeth are the most dangerous because if you ever had a friend that wakes up overnight and has a golf-sized swelling on the face, it's mainly from a necrotic tooth because they don't give you any warning anymore. They're giving you all the warning they can. Pain, you've been chewing antibiotics and pain medication. Now they're dead. Guess what? Bacteria is like, good. We have him where we want him. Next day, big old abscess. So that's why you have people moving around with bad teeth, broken teeth, and there's like nothing going on. So it depends on the individual pretty much. There's no straightforward answer to that.
I know I came in a little bit late, so I didn't know, did you discuss about bad breath and early morning breath? I mean, how do people control that? I mean, if we have friends that do have bad breath, how do we help them out? I mean,
hey, well, you can brush their teeth for them.
No, because I have a question about that. I have a question about people that suck their fingers also.
Oh.
And people that normally keep their mouth open. I mean, how does that affect?
Well, let me
dental structure?
Let me handle one at a time. Let me go. This first question, I really get the second question, but the first question, bad breath, very important. Again, it's a social thing. It's a social issue now. Nobody wants to be associated with bad breath or BO, body odor. It's not good. But let me tell you what, I've found out, even the literature or the books have said it, most people that complain about bad breath, it's mainly a local factor. What do I mean by a local factor? Again, you have decay in your mouth. I told you guys about putting food out. You put food out, it's gonna go bad. It's gonna rot, you throw it away. If you have a cavity, that's decay, rotten teeth, anything rotten smells. So if you have bad breath, it could be due to the fact that you have decay in your mouth. Okay, if you have, it could be because you have decay in your mouth. Or the other thing that maybe you have gum disease. Gum disease is when you have a lot of plaque and calculus in your teeth and it's breaking down everything. You could have bad breath. So I tell my patients this, let's start from somewhere very simple. If you experience a bad breath, if you're brushing once, you want to brush twice. But most importantly, you want to scrape your tongue, you want to brush the tongue. Most of the bacteria that causes bad breath, guess what? They have their houses on the tongue. They live mainly on the tongue. So in addition to you brushing, you want to use like a tongue scraper. That would definitely help. Guess what? If you do all this and you still think you have bad breath, it's caused by a bacteria. What the dentist can do in that case is take a swab, take a mouth swab, send it out for culture. Once it's cultured, we now know that, hey, this is the bacteria that's predominant. This is sulfur-producing bacteria. It's dominant on your tongue. Then we have to fight it. Antibiotics, mouthwash, or whatever we need to do at that point, we will. So those ones are easily treatable. But there's some bad breath that never really goes away because it's not dental. If you have a lung abscess or you have upper respiratory tract infection, sinusitis, all that stuff, guess what? You can brush all day, floss all day. It's not coming from your mouth. It's coming from somewhere else. If you have GI problems sometimes, ulcers sometimes, it could be coming from somewhere else. But the very basic place to start from for bad breath is the mouth, teeth, and tongue. But it could be something bigger than teeth and mouth. That's pretty much it about bad breath.
Right. Okay. Good. Mr. Bob, are you trying to say something?
Question. I still have a couple of questions. So,
Hello?
Sucking fingers, Uncle, because I've seen some grown-ups sucking fingers. How does that affect it?
Is that a dentist thing? That's just a bad habit thing. Wale, let's move on.
Okay, then. So sometimes some people leave their mouth open. Does that also affect their breath, or what does it do?
if people
And
Well, mouth breathing, the number one problem with mouth breathing is pretty much, teeth likes to be hydrated. What I mean by that, your teeth likes to be wet, So if you're a mouth breather, your teeth become dehydrated, then it's now more prone. Remember when I said if you're talking like I'm talking right now, my tongue is moving up and down, I'm producing saliva. That's a natural way to clean the teeth. But now, if you're a mouth breather and you're sleeping, the environment becomes even more dry because saliva production is less, tongue's not moving around. In conjunction to that, your mouth is open, you're not locking in any moisture because teeth likes moisture. So your teeth becomes chalk-like. But let me tell you what, this doesn't happen overnight. The teeth is the hardest structure in the body. If you watch forensic files 200 years later, they will find the person's teeth, but the bones are gone. So teeth have to go through a lot of abuse. When I say abuse, I mean serious abuse for them to really, really, really break down and give up.
Right.
So yeah, so pretty much answer Wally's question. That's pretty much it. Then I'll be real quick about thumb sucking. Thumb sucking, as Emeka said, sometimes it happens. We'll do pacifiers, you get rid of the pacifier. It's easier for the kid to suck the thumb than the pacifier. There are modalities we can do to check that. People like to do what's called a tongue crib. A tongue crib is a device that's put in the mouth. The orthodontist will do that. It's like a little guard. You can't really put your thumb in because it's a tongue crib. But these are extreme measures because sometimes the kid can scrape the tongue on the tongue crib, the tongue swells, you're dealing with glossitis, inflammation of the tongue. It becomes a bigger problem. You're trying to solve a problem by a bigger problem. So that's one. So there are many other ways we can do that, but you can call me, we can talk more about it. If you want me to elaborate more on that, I can, but that's just part of it.
Doc, a lot of us are coming to see you. I hope you're ready. Wait.
Dr. Chris, Dr. Chris, where is your office located?
I'm in Greenville, Texas.
Oh, and so we have a lot of people who don't have insurance, and they're probably from another country trying to visit. What are some of the best things that they can go and have their teeth worked on? Because sometimes in Africa, like you all say, we're from Africa, and sometimes the dentists there are hard to reach or they're too expensive. So maybe they've come to visit or something like that. What do you suggest they can do to maybe have their teeth worked on without much insurance?
Well, we talked about this earlier, but I'll just recap real quick. I think one thing is to let the dentist know that, hey, listen, I'm cash pay. Again, we like to hear that. If you're cash pay, we don't have to wait for the insurance to pay us 60 days later. I'll be like, okay, fine, this patient is cash pay. We can do a 20% across board or 30% across board. That's going to help because let's be very factual. If you don't have insurance and you're visiting from another country here, it gets really, even with insurance, it gets expensive. Talk us without insurance. So you can always talk to the dentist, be upfront with him and let him know what's going on with you. And, sometimes you might meet a dentist that's so compassionate and will go ahead and get this treatment done for almost at the same price that he would charge someone that's actually a resident here, or maybe even lower. So you just have to talk to the dentist. And that's pretty much how that's going to work. Or you go to like big institutions, like you go to Parkland, to Baylor School of Dentistry. I know they have a dental school in there because they are teaching the students. You're pretty much, I don't want to say guinea pig. I hate that word because you're helping dental professionals advance. You're not a guinea pig. You're just someone that's pioneering dentistry to the next level. Then you can talk to them and say, hey, listen, toothache, this, that. Those places can take you in because their students are being trained for the next generation. And the price will come down because it's a quid pro quo. You're giving them something, students are learning, they're taking the hit off your pocket. So everybody's kind of in a symbiotic relationship. That's the only thing I can see.
Can you elaborate on that a little bit on what Mr. Bob is saying? Like how you sent the other one, the other website called Carevite, right? Is that something similar to Carevite where people could come in if they don't have a lot of funding, they could be seen, but for a very discounted rate, but it wouldn't be as perfectly professional as a one-on-one dentist. So is Carevite like the same thing you're talking about, the Baylor students doing some, not experiment, but helping you fix your teeth?
Yeah, they're very similar. The dental school, of course, they're trying to, train young dentists and all that. Kevite, all this community, let's just say community dentistry. They are not like my practice. My practice is a for-profit. I'm in it to make money. Kevite is pretty much an NGO. It's a non-governmental organization. So they get money from wherever and provide care. So so you can either do a community dental practice. You can Google them. I think they have them in different places.
Yeah.
But I know about Kevite because it's close to me.
Yeah.
Then they can now look at what you have or what you don't have, and then pretty much treat accordingly based on that.
Okay, very good. Okay, Bob, do you have another question? Or is that good? You're mute. You're mute.
Oh, I kind of, I do apologize. I kind of came in late, so I didn't hear that part of the care bite. Could you get that information in there so that maybe?
I just put it out here right now. I just
put it out there. Okay.
Check it in the comment section so that
okay.
If you just click on that, you could see, I think probably most of the locations, so that there's one close by, our people can go in and just from out of town or from overseas, they could get in there and get the discounted rate,
And the other question is, how do dentists work? I mean, do they have payment plans for people who are looking for like maybe dentures or bridges or the new technology that is out there? Does everybody, is every dentist knowledgeable in putting the new technology for dentures and stuff like that, or the new implants? Or do you have to look deep for the right people?
Yeah, it's I mean, you have to research. You have to look for whoever. I mean, it doesn't matter what you're doing, whether it's an implant or filling. I always advise people. Let me tell you something. The medical profession, before you do something on me, I need to check you out. It's not like fixing a car. So you're right. You have to really check them out and see, what kind of dentist this person, what is the training, years of experience. So those kind of things you really have to. And again, I always tell my patients, I have some patients that come to me, they look at me funny after I tell them everything. I say, listen, go get a second opinion. And if the second opinion is the same as what I'm telling you, please come back because I'd love to provide you service. I'm not trying to chase them away. I want to see them. But I'm telling you, go get a second opinion. So I'll tell you guys the same thing too. Always get a second opinion when you're in doubt. It doesn't matter whether it's dentistry or plastic surgery or whatever it is. Always get a second opinion. You can never go wrong. Ultimately, it's your body. I mean, how much is insurance going to pay you when you're deformed? You don't have time to enjoy the money anyway. So why not get a second opinion? That's pretty much it.
Right. Hey, brother.
So my late night snacks, I had a question in regards to late night snacks also. What kind of snacks can we eat at night or for us that affect our teeth?
Well, they finish me here. just brush your teeth at night. That's what
you're killing us with the question. Wale.
I eat peanut before I fall asleep and I'm on the bed and I'm too late to get up. So would that invade decay?
Well, Emeka has answered the question. I don't want it to be. Emeka answered. I don't want
just brush your teeth after you eat. Whatever you eat, your own. That would be different from.
To sleep. I try to snap with some peanuts.
Huh? Wale, hold on. Let brother ask a question. Wait. Brother, go ahead.
Okay. Dr. Chris, I had a question for you. So I grew up in Kenya and we had several cases, actually more than several cases, where people's teeth, regardless whether they brushed, once or twice a day, they would have teeth discoloration. And it came out that it was something to do with the water. I don't remember the exact name of the condition, but it's something having either high fluoride or something in the water. Right. And the only choice they would have is to have either crowns or even teeth cleaning wouldn't whiten their teeth. And right. I've had a couple of people asking about teeth that is messed up or teeth that is brown. So in this case, do you want to elaborate a little bit more about this condition? And I don't know if you're familiar with it. I know I haven't seen it much in the States, but I know in Kenya we have a lot of it.
Okay, yeah, that's a good question. Yeah, tooth discoloration. But okay, let me just break it down. There are two kinds of tooth discoloration. There's one that's extrinsic, there's intrinsic. Extrinsic means, let's say you eat something like some of my kids, they'll suck on this 7-Eleven sloppy. Their tongue is blue. You see a little bit of blue tint on their teeth. It goes away. That's extrinsic. But intrinsic stains are the ones that penetrate the tooth structure itself. Based on what you're saying, I mean, you hit it on the head when you said hyperfluoridosis, like a lot of fluoride in the water can cause your teeth to be mottled. You have that white streak. At the same time, too, if there's no fluoride, it can also cause that discoloration. So it's like, you can't win for losing. Too much, discolor, too little, discolored. Again, that is why, too much of everything is bad and too less, I guess, might be bad too. So
Right.
that fluoride stain, that one has impregnated the tooth. Again, in Africa, one of the biggest causes of discoloration is antibiotics, tetracycline. Tetracycline is notorious for discoloring teeth. I mean, it's a proven fact. And guess what? With tetracycline stain, it impregnates the tooth so much. It doesn't matter whether you whiten with Zoom or whitening with whatever you whiten with, it's not going to change because it's an intrinsic stain. So extrinsic can come off, you go clean your teeth, you're like, oh, my teeth looks whiter, I got the cleaning done. But if it's intrinsic, it's not going to look any wider. So that's where what you said comes through. Now, because the tooth itself is discolored, we're going to try and mask it because we can't clean it off. Then you're looking at veneers, then you're looking at crowns. So pretty much we're covering that discoloration underneath. So this discolored tooth will still be underneath. But what people see is what's been masked over it, so they can't see underneath the crown. If that answers your question.
Yeah, it does. Thank you.
Yeah. Quick question. Let me on that. Quick question. So is the discoloration actually coming from the water, or is it from the antibiotics? From what you're seeing, is it possible that it's the water that is coming from? Or
no, it's not from the water. It's not from water.
It's not from the water.
Yeah. This is a little bit of biochemistry. I don't want to go there, but we'll go there a little bit because, like, your teeth has what is called hydroxyapatite. That's the main constituent of the teeth. Okay, the hydroxy group, the hydroxy group there is displaced by the fluoride. So if you now have the hydroxy group displaced by a lot of fluoride, so it is now impregnating the tooth structure itself. It's impregnating, it's like the DNA of the tooth. You see what I'm saying? So I don't want to go into too much biochemistry. It's coming from that displacement of the hydroxy group or the fluoride group. In the case of the tetracycline stain, which is the antibiotics, that happens when the teeth are in its formative stage. I mean, as an adult now, I know many women that take tetracycline for acne. Their teeth is not brown, it's not getting discolored, but they're taking it now, their teeth has already formed. They're using it for acne. It's not going to do anything. But as a child or a teenager, when your teeth are still forming, the tetracycline disrupts the metabolic process of that formation of the tooth. So that is when it now impregnates the tooth during the formative stage. It now becomes intrinsic. So that's pretty much how to look at, water and antibiotics, how they both play a role in that. Okay. Yeah.
Francisca, did you have a question?
Yes, I do. Hi, Dr. Chris.
Hi, how you doing?
Good.
I know
this
you.
Is Timmy.
I know you. I know Timmy. I know you. I just see your picture. How you did now?
I did good. Really good.
Awesome.
Thank you.
No problem.
My question is in regards to gap. Like I had my one of my molars removed when I was like 10, 11 years old. Back in command. the military dentist. Now, as I grew older, the rest of my dentition moved. So I have a large gap at the lower part of my mouth. Now, I intend to want to cover that up. Would it be only braces or are there other options?
Well, Again, it depends. I cannot give you a straight answer without seeing you, but let me just tell
Okay.
you what it should be. Sometimes I have patients that come to me, they have like gap in between their teeth. Let's say, for example, let's just make it really simple. These two teeth in the very front right here, like you smile, the top two teeth right in the front. If you have a gap between them and you want to close it up, guess what? If you decide not to get braces, we can close it up with crowns. But guess what the problem is? That space is not going to disappear into thin air. You see what I'm saying? So now we're going to distribute that space between those two teeth on the adjacent side. Guess what? Some people were like, this tooth looks like a horse tooth. It's too big. That is exactly what's going to happen. So to answer your question, it's based on the size of the space. If I see the space is too big, and if I split the space amongst the two teeth adjacent and it looks too big, it looks unnatural. A keen eye will catch it. In that case, I always tell the patient, the space is too big to cover it with a crown because you have the gap. Then you have to go the braces route. All they're doing is moving your natural size teeth that fits your perfect face and push them together. And we're not trying to make your teeth bigger than it normally should look. That's the solution to that.
Got it. Thank
so
you.
braces. Okay, braces.
Thank you.
You're welcome.
Victor, I want to put Dr. Chris on. So, two questions. First, a follow-up in regards to what Rhoda asked. Hydrogen peroxide to washing the teeth. Is that good? Because I tried using that and I noticed it started creating discoloration on my teeth. So a lot of people say you can use hydrogen peroxide for the teeth.
Well, we can't hear you well.
I can't hear him.
Yeah, we can't hear you.
Can you hear me now?
It's real low. Okay, try again.
Is it better now?
Yeah, try again.
Hello, is it better now?
Yeah, try again.
Okay then. I said hydrogen peroxide for brushing the teeth because I had some people said it's good to make your teeth white, but in my case, it was giving me discoloration.
Okay. Doc, can you talk about types of toothpaste and what will be the average best one to use for the regular people and the differences?
Well, thank you, Emeka. That's a little bit beyond my scope. What I mean by that is pretty simple. Toothpaste is like what is going to work for you is what you're going to use. We can't recommend toothpaste, this one or that one. I mean, if they're paying me, I'll recommend it, but they're not paying me, so I'm not recommending anyone. Yeah. But the trick is this: the truth of the matter is, any toothpaste you buy, look at the container. It will say ADA approved, American Dental Association approved. So those are the ones that have been vetted by our governing body here, which is the American Dental Association. It means they are safe. Then there are some of them that have things you can use if you have gum disease. They have some constituents in there that will help with gum disease. There are some of them that have a little higher fluoride if you know you're prone to decay. So there are some of them, like Wale said, they have peroxides for whitening. It will help. So it depends on you. What is best for you? What are you looking for? Are you looking for teeth that are a little whiter? You look for a toothpaste that says with whitening. You want teeth that, healthier gums. You want to get one that says, this has this for gums, for gum treatment, whatever. So it all depends. I can't recommend anyone.
Right.
Whatever works for you, that's what you're going to use.
Read the label.
How it is. Right. That's the way it is.
Okay. Now, yes or no to hydrogen peroxide for the average person?
Well, I don't know. That thing is just a fallacy to me. I don't know what hydrogen peroxide will do for you. Right. Besides change the bacteria. It's not hydrogen. It's not the peroxide that we use for whitening that has whiteness. It's not the one that you find in that white bottle in Walmart. Then you now sizzle and say yes, it's doing something. It's totally different. The composition, it's like the packaging is different. The structure is different. The chemical balance is different. It's not the one you see in a white bottle and think it's going to do something for you. They're totally two different things.
Different things, correct. Okay, very good.
What that bottle one, I would say this though, Emeka, before we go. What that one in the bottle does, again, your mouth is full of anaerobes. Anaerobes are bacteria that don't like oxygen. They're called anaerobes. They don't like oxygen. But guess what? When you use hydrogen peroxide, what happens? it bubbles up, right? Bubbles up, bubbles up, bubbles up. So now it's now feeding the bacteria that don't like oxygen. So they now die. So what happens now? It's like you're now replacing the normal flora with a flora that's not supposed to be dominant. So you now start, yes, you now start having other things happen with prolonged use of those white bottle hydrogen peroxide. Again, this is just that's just what happens. So
Correct.
pretty much using hydrogen peroxide. You're just changing the population.
Right. Okay. Does anyone else have any question?
Last question. Mouthwash. What do you think about mouthwash? Because there are some of them are very hot when you try to use them. They're addicted with mouthwash.
Now, mouthwash, there's nothing wrong with mouthwash. Again, it's like a million of them out there, million. So if one of them is very harsh, it might be maybe the constituent, because some of them that have alcohol in them, alcohol is what makes it harsh. They have like the phenol group. The phenol group is pretty much related to alcohol. Not straight alcohol, it's called the phenol. That'll make it burn. But there are other ones there that don't burn. So you want to get the one that's phenol free or alcohol free, it won't burn. You can use that, but I can't really tell you which mouthwash is better than the other, so that's pretty much how to look at your mouthwash.
Right. Okay. Well, thank you so much for that. Let me see. Yeah. Do we have any other
people?
Huh? Well, let's ask other people now. Wait.
Let me just have the last that they drive, no vex. That's what I'm trying to get to my question.
Right. Okay. Do we have any other questions for Dr. Chris? Anyone else? Okay. It sounds like you've actually answered everyone's question. Now, is anyone curious about anything? If you are shy, just text it out, or write it out here in the chat box, and we can ask Dr. Chris about it.
I mean, that's why I've been asking questions. People have been messaging me, so I'm asking on their behalf.
Okay. Okay. Ask.
So I have the last one. Are there any kind of deficiency that affects the teeth?
Say that again.
Sorry, say that again.
Any kind of deficiency that affects the teeth? There any kind
Wale, is Wale driving or what? We can't. He's going in and out. We can't hear the question.
Wale, you are distorting.
That affects the teeth.
Okay, so Wale, we can't hear you real good, but let me ask this question. There is a question from Tosin. Is saying, what is your advice on pop-on veneer?
On what?
Pop. It's right there on the chat, just in case.
Pop-on veneers?
Yes. What is your advice on that?
My advice is you look for a dentist that knows how to do it. I don't do pop-on veneers. They're very selective. I went to the class once, but I wasn't too thrilled. So I don't do them. I can't really advise you on that. I'm sorry. But just look for a dentist that's pretty much very familiar with that pop-on veneers and all that. I can't really give any advice on that. I don't do them. Never have, so I can't really talk on that.
Okay. Who else? Let me see.
Okay, can you guys hear me now?
Oh, yeah, okay, well, go ahead. You said you had
what type of deficiency can affect the teeth?
What do you mean by deficiency? Talking about vitamin deficiency?
Whether vitamin or health food nutrient-wise, that the teeth needs to survive. Because most of the time that everything we know about teeth is mostly calcium. So what the kind of deficiency that if somebody lacks might affect the teeth from developing well?
You mean like calcium? They don't take enough calcium and stuff like that? Right? Doc, do you have anything to say about that?
Well, I'll call Wale and we'll talk about that. It's a whole big, Wale is thank God is my patient.
Yeah.
But yes, we can talk about things like vitamin C deficiency affects the gums, scovery, or whatever they call that.
Right.
We know vitamin D is very important for hard tissue, and the teeth are considered hard tissue. So I have a whole thing I can discuss with Wale after that,
Yeah.
because it's quite a broad topic.
Sounds good.
Wale, I'll
Wale,
call you.
please call doctor. Call him. Dr. Chris, we are
Okay,
so
that's all
thankful
for the
for
night
your
as I'm
time
going into
today.
my house. Does chewing bone really help to exercise the teeth?
Wale, please call Doc. He's your patient, right?
Does chewing
Doc,
bone really
Doc,
help to exercise the teeth?
Wale, wait. You know this is a recording. Doc, we want to thank you so much about your time here, and we really appreciate it.
Thank
please,
you.
For anyone who appreciates Dr. Chris, please can you show him some love? You can speak out here, or you could send a message on the chat box, so he will know he's very much so appreciated. And I'm hoping most of you, if not everyone here, come and patronize him, and tell him that you saw it here, you get a discount, and maybe he'll put something in my pocket. Anyway, so please show some love, and I really hope you guys would take your dental hygiene a little bit more serious now, because it's easier to do. It's not as expensive as everyone thinks it is, but the process is quick. Obviously, when you have someone experienced, but also they will educate you while the process is happening, so you know what you're getting yourself into. So, Doc, again, I want to thank you. And
thank you so much. Appreciate you.
Does anyone have anything else to say before we close the meeting?
Yeah, I just want to say thank you, Doc. I came a little late, but I got a lot of information. Really, thank you. Please leave your contact so we can reach out to you.
Thank
you. Easily.
Thank you so much. Appreciate you.
Yeah, I was going to add to that just to say thank you, Dr. Chris, for the information and for your time. I know it's not easy. A lot of information getting thrown at you. I also wanted to tell Emeka, joined the group not too long ago. And if there's sort of like a market day within the WhatsApp group, sort of where businesses can advertise themselves, as Africans, we really need to consume our own products, just like African Americans are doing that.
Mm-hmm.
So I would like to encourage, if it's not being done already within this community, we can even create our own sort of like spreadsheet with businesses that are here locally within a certain radius.
Yes.
And it's sort of like our yellow pages, digitally.
Yeah.
We can access, because like today I know about Dr. Chris, who's right here in Greenville. I may not mind driving maybe 30 minutes to get a dentist who understands me culturally beyond just my basic need of getting dental care. So I think that's very important if we can do that within our community. So thank you very much.
Beatrice, we should talk offline about this, because this is very important. But I also want to tell you, we have a website called African Experts, which Rhoda, please, can you put that out here so everyone could see, where anyone who has any product they want to advertise or get the word out, they could also put the website out here. Sorry, not the website, what they do out there, and put that complimentary card or business card in there, so everyone could see what they advertising or what they do, how to get a hold of them. It's on the website right now, on the chat box right now. And you can see all that information in here. And but just like you said, Beatrice, we will do better and work on it. You see, this is all a work in progress, right? You brought up a great idea, and we are going to, invest time into it and see if it's going to be successful. So yeah, I thank you for everyone who came, and anything else.
Thank you so very much, Dr. Chris. We appreciate all the details. Yeah.
Thank you.
Chris.
Well, Emeka, I just want to thank you for inviting me to this forum to speak. It's been a while that I've done something like this, but I'm in my natural element, and the questions were just fantastic, and I just love it. I mean, very learned, educated people here, intelligent questions. I just want to thank you. Thank you for giving me the opportunity to share and promote dentistry, which is what I do. Thank you so much.
Thank you so much, Doc.